All right. If you've reached this video, I'm sure you've noticed that this is a nearly 3 hour interview. I just broke them into segments. Again, my name is Brian Kui. I'm from medicalcodinggeek.com. This is part 5, or maybe the bonus portion of the student mentoring and professional interview provided by a student by the name of Norma. The last part 4, she really completes her interview with me, but I was surprised when she said, "Do you have some more time?" I'm like, okay. And so in this interview, she really wants to go into more about the industry. I think she has more of a health data focus. She was really into release of information. So I just provide her some insights as to what she needs to do to prepare herself when she gets out into the field. She's done the first part. She's done the first part of reaching out to professionals, and she's going to repeat that process. And I think the update from there is that she reached out to me and she's actually gotten motivated to look for positions, even though she is not in the program yet and also not certified yet. Just being empowered to connect with people does wonders. So please check out this bonus video. You might get some insight, especially if you are a student in medical coding, a student in health information technology, also an educator. Hey, use these videos to show them to your students. Let them know that this is how you should conduct your professional interviews. Anyways, here is part 5, bonus content with Norma. Enjoy.
I actually had, I don't know if you have a little bit of time. I don't want to keep taking your time.
Sure. Go ahead.
I know that question is not here, but I have been doing like my own research and I have been looking into like different fields, and I've noticed that it's not just medical. There's other fields out there that entail these types of skills that come with health information technology. I've seen Google, I've seen law, right? I think you mentioned law
Google,
too.
Amazon,
Microsoft.
I've
seen a lot of positions out there. Obviously, there's like, you need the experience, but I've also been trying to tap into programs or systems. I don't know, like you have to be very familiar with a specific system. Companies have to work with different type of software, right?
Yep.
So I don't know if you have any recommendations. Is there anything that I could download myself now so that I could start, maybe, because right now I'm taking CIS, which is a computer information software, I think, something like that. And so basically it's just basic stuff. It's stuff that I already knew. It's just Excel, it's just Microsoft, it's Word, it's PowerPoint, it's Access. I don't know if you've heard of Access.
Yes.
So, but that's all something that I feel like I learned like early on in my life, because with Word and Excel. But ever since I started taking this class, I started, trying to see what programs am I going to have to be savvy in? What software am I going to have to be? I know that there's a software that a lot of hospitals use, but it seems like you need a sponsorship.
Oh, Epic.
Yeah, Epic.
I've worked with that. Yeah.
Oh my God, like, what is that? That's so cute. To me, I'm curious. I'm like, how can I learn it? And I've been YouTubing stuff, like trying to learn more from it and see if like maybe I could download the software, but no, that's like clearly not.
I don't think it's about software. I don't think it's about the system. It's about the workflow.
Okay.
You see, so like I understand why you're asking this question, because I was in the same boat. Like I've tried to get into like information technology positions. So like, for example, before the CDI position and before the HIM director position, I was a HIM technician, right? So I just did the medical records. And before,
that's how you started.
Yes.
That was your first job.
No. Before that, I was a radiology film librarian. Like I would, when they take the X-ray films, I would file it. I was the one who
Oh,
handled
okay.
all of that. So what happened is they transitioned. This again, when I first started, they were just transitioning to electronic health records. So one of the
Mhm.
systems that radiology was started to use was called PACS, Patient Archival Communication System, which is basically the digitization of X-rays and putting it into a
Okay.
server, right? So I was just there when they made the change and they were looking for analysts. And then I knew I couldn't get the job, but I knew the workflow and what is needed to do the position. You know what I'm saying? It's like I knew the workflow. I try to leverage what I did as a librarian to get into that role, to the point that I had four, and they gave me four interviews. They gave me a shot, but unfortunately they
Mhm.
wanted somebody who knows how to do x-rays, like an x-ray technician. But that
Oh,
experience in
okay.
itself kind of taught me, like, I need to know, if you're wanting to get into the system, you need to know more about that system and its process. So, for example, Epic. I was there when they I think the only way if you get into a system is if you're there at the time that they're implementing it. That to me is the
Okay.
only way if you can get into, like, say for example, Epic. Okay. So Epic is, I don't think it's a software, it's just a system. When you think of system,
Mhm.
it's just a a program
Like a
develop,
database,
yeah,
right?
like a, not a database, but a program development for data entry. And then from the data entry,
Okay.
they gather like then they gather the database. It's just a solution to to remove handwritten notes. That's how I saw it, right? Because everything was
Okay.
handwritten,
Okay.
right? Everything was handwritten. If a
Mhm.
doctor needed to do an order, they would handwrite the order. Who do they give it to? They give it to the secretary. The secretary enters it into the system, right? Then it goes to the
Mhm.
pharmacy. Pharmacy brings up the meds. They give it to the unit secretary. The unit secretary gives it to the nurse. The nurse, and everything. The paper trail is then handwritten, right?
Yeah.
So when we think of Epic is now, it reduces the paper and it reduces the amount of processes to get a job done. So if a physician needed to order a med, they didn't have to deal with the unit secretary. They just enter it on the computer. It goes directly to pharmacy. Pharmacy then sends it up to the unit. So the time, again, anything about time and reducing time and processes, that's what it solved. So the way I saw it is like, okay, like if you're trying to get into a system like Epic, like Cerner, right? That's another one. You have to go to a facility that is about to implement it, right? So
Okay.
for example, here's another example. My wife used to work with me in the same healthcare system. So she got her nursing, but then she started working the ER um, at another facility. So when they rolled out
Mhm.
Epic, I think no. She worked for the hospital that had Epic. She went to another
Mhm.
hospital that was about to implement Epic. So
Okay.
so that she touted her experience in Epic and they made her a super user. Meaning
Right.
the super user is the people who train the people to get into the
Mhm.
program. You see? And so as a super user, and she's doing it now with her current position up here in Orlando. Orlando Health is where she works at. And she leveraged that super user status. Like, oh, I've been a super
Mhm.
user at other facilities. So, okay, let's make you a super user here at Orlando Health. And so, if you have that experience in super using, teaching people how to use a software program, then it could elevate you to making changes in the actual software itself. Because as a super user, one of the things that you should know is that you should be able to identify the problems and the processes. So you
Mhm.
have the workflow, okay? You have the system, okay? How does it work with the system? But then the problem is, how do you identify the problems in matching the workflow with the system?
That's what
Yeah, because
that's
you
yeah.
stumble with errors sometimes,
Yes.
right? You'll
Where
get
are the
errors.
errors in the workflow in relationship to the system?
Okay.
That's how you should approach it. Like, oh, I know how to fix that problem, or I know what here's a
Yeah.
problem. Let's get it fixed. Oh, I see. Like, so, like, say for example, Norma, I see you identifying a lot of problems with Epic. I think you should join this team and help us solve those problems. Like, how can
Mm,
we? So then, if you know how to identify the problems, be ready to solve those problems.
okay.
Does that make sense? It's like
Yeah, it does.
workflow, like workflow.
Yeah.
That's how you leverage yourself into that type of role. Like I can connect you with
Okay.
other people who've done it. There's one who up in Washington. I think she's up in Washington. Her name is Sarah. She's RHIA working with Epic, consulting with Epic implementations. That's all she does. That's all she does, right? But again, it's all about workflows, getting in there, identifying the problem, solving the problem. She got her project management, I think, certification, if that's what you want to do, learning how to do project management, because if you're
Hmm.
if you're implementing something, they're gonna have a project manager. You don't necessarily need a degree for that. It's something to add on.
Right.
The RHIT, the RHIA is enough, but it's always good to carry more. And having a project management license outside of that, oh my gosh, could you imagine how many consulting jobs you would do? How much traveling you could do? How much money you could make? Six figures easily. So much easy. You see? So like
Yeah.
that's how I see, if I had done it that way, I would have gotten my project maybe I still can get my project
Hmm.
management certification. Um, do a little bit of research in your area. Was it California, right? So like find out a hospital or organization or find a company that is doing consulting into implementing systems. Like how I did it with DRG validation. Like get creative with what you do.
Yeah.
Don't just label yourself as HIT.
Yeah.
Take what you do and then make that its own search.
Yeah. It's like the hashtag, huh?
Yes. Perfect. Yes, I agree. What a good
So,
analogy. Yeah.
so right now, obviously, I'm not even in the program yet, but I want to obviously
But you
get
have a good head on your
into.
shoulders. That's what I see.
Thank you.
Yeah. Mm-hmm.
I want to like get in the field, even if it's on an obviously entry level. So what positions? I don't even know what to search, like, because there's so many titles.
What are you currently doing
That
now?
I'm not working
You're
right
not
now. I don't
working?
work. I'm just going to school.
What have you done in the past?
I have done inventory for a company. I
Okay.
did that for 12 years. I mean, I'm sorry, 10 years, and that's basically the
So like
main one
warehouse
that
work
I.
and all of that?
Yeah,
Okay.
but it was more on a administrative level. It was
Okay.
more like, use the system there and know the codes there too.
Inventory categorizations, knowing how to find
Yes,
stuff. You know what company would work great with is
I did biometrics for 1 year too. I was a fingerprint.
you do the processing of the fingerprints. Okay.
Yeah, I did
You
that
could
for
do
a year.
what else? What is it, the one that I was thinking about? Release of information. There are a few companies
Okay,
out there like
that are
Ciox.
entry level.
Yes. Release of information. Ciox, CIOXX. There is,
CIOXX.
yeah, CIOXX. Very entry level.
Okay.
Um, Companies like that. So start there and find similar companies like that. Um, I'd like to say Iron Mountain. Iron Mountain was a very old company, but I don't know what it is now. But Iron Mountain was what was a solution that I needed for my jail system. But I don't know if they still
Okay.
are around. Taking old records and housing it for them, or taking old records and scanning it for them.
Yeah.
Document imaging, huh?
My counselor, she connected me with one of the students that recently graduated from the program, and I got a hold of her, and she told me that she's working at a hospital around here, and she just said that she scans documents.
Yeah. Start there.
So,
And I have
yeah.
friends that did that and they moved up into management roles, director
Okay.
roles, that type of thing. Then you can, it's like you go from here, you go from there, and then parallel. You understand what I say? Parallel, like take something from that role and
Hmm.
find something that is not that role, but takes something from that role,
Uses something from that role.
yes, into a different role. Like for
Okay.
example, CDI, I took DRG validation and found an auditor position.
Yeah.
Like now I want to take appeals and take that to an appeals position. You see, like
Hmm.
you're taking
Yeah.
it to different areas, or you could either go parallel or you can elevate. You could
Right.
take it to a higher level position. So those only two ways that I can think about going in directionally.
Yeah. It's the tricky part is knowing those key words and how,
Yeah.
because there's like an endless amount of an abundance of just different titles for every different company. There's like a different type of title, and you
Yes.
look at the title and you automatically think, oh no, like just because it ends in specialist, you think, oh no, I'm not qualified for that, even
Yeah.
though it
Yeah. Yeah.
might be an
Yeah.
entry
I
level
get.
position, right?
Yeah. I know what you
So
feel. Yeah.
that's the problem that I'm having right now, that I just don't have. And I sometimes I even just type in HIT or I type in HIM, just to see what I
Mm.
get. It's like I don't get too much,
Yeah.
you know.
Yeah.
I
It's like you get
I'm
the normal positions. I used to
Yeah,
do health information technology, health information management, but then you would get to, the in the box type of positions. And
yeah.
you're like, okay,
See?
I always wanted to do something like that's when I found the jail system. I'm like, that's so out of the box. That's like outside of the
Yeah,
box and over in left field that I think that's something that I think I would do. And when I got into it, I was like, okay, correctional healthcare. That's something very interesting. Like you get a term and you kind of run with it. And I even thought about being certified in correctional healthcare, but then it didn't work out that way. But like you see where I was going. I'm like, once you get into a position, you see like where you want to go. Like create
yeah,
options for yourself while you're
yeah.
in a
My
certain.
mind just thinks, and I'm thinking like government jobs.
Mhm.
Like I
Government
saw
jobs are good.
one that was for veteran affairs.
Mhm.
It's a hospital here in Long Beach,
Mhm.
and I think that's like a government job.
Yep.
So it was like, wow, like that's crazy. Like that seems like where I feel like I want to go in that direction. Like
Okay.
even though I don't know anything yet still, right? But I don't know, I feel like the curiosity's in there where I want to like tap into it and see. I don't know, I just feel like it's like something where I'm kind of set. I'm set and I feel secure with that type of job. Even though
Okay.
I don't know if it's like the right way
Yeah.
to think. You know what
Mhm.
I'm saying?
There's a YouTuber. What's her name? Hold on. Let me find it for you. I don't know how to spell her last name. Hold on. It is Amanda Chalk. Chalk, Chau. Hold on, let me find it. But she works for Veterans Affairs, by the way.
Okay.
Um, Amanda, yeah, is that her name? Chalk. Hold on. Yep, Amanda Chalk. Coding with Amanda Chalk, like the the thing you write with. Amanda Chalk.
Oh, CHALK.
Yes, she does videos saying that she works for Veteran Affairs. She codes for them. So you could watch her videos, even connect with her, let her know that I sent you.
Okay.
Um, there is uh what's her name? Well, she worked for the well, the one that I'm thinking about, she worked for the military and she's wanting to do something with the VA, but her name is Melissa Freeman.
Hmm.
Melissa Freeman. Oh, do you have LinkedIn?
I just opened one
Good,
last week.
good, good. Start with that. Because all the names that I'm giving you, they might be on LinkedIn. So Melissa Freeman's on LinkedIn. I'm on LinkedIn. So
Okay.
connect with me. You better connect with me first.
Okay. I will.
um, Amanda Chucks from the VA. Another one for Epic is Sarah, Sarajama. Sarah Jama. If you're wondering about Epic, that's my go. That would be my person to talk to. For that, you know, even though I mean, I'm just giving you the person. I don't know if they're going to respond, but they, you know,
Yeah.
if I got to them, then I'm sure you can get to them too. If they're, so I haven't talked to her in a while, but we connected, and I kind of helped her with coding, but then she's also going to give me insight on Epic as well.
Okay.
I think that's it. That's all I have for now. But I mean, I have a podcast. I don't know if you've listened to that. Aside from the YouTube, I have podcasts. And so I did one with a computer science person. And so, like, it's surprising how somebody who is not in coding, medical coding, understands medical coding, with a computer science degree. So it's like,
Yeah.
it shows to me like you don't necessarily need the education per se. You just need to have a fresh set of eyes and just look at it and understand, I guess, find the resources aside from what school can offer you and learn it. But you won't learn it unless you ask questions or you're not in it and trying to troubleshoot the process. That's how I see it. But if you
Okay.
do that, like that's how I always walk through my career is, how can I, number one, understanding the workflow. What can I do beyond the workflow? Identifying problems within the workflow and creating solutions. That's all I've done. That's all I've done. It's like, okay, because then everything that's in my mind is like, it's been saturated enough to the point that I had to create a podcast and a YouTube video. It's like, who am I going to talk to about this? Who's going to listen to this garbage? It's like, okay, there are people out there, yes. And so it's
Yes,
like, okay,
there
I
are.
mean, I'm not interested in, like, getting a big following, but like, I just need to, like, let it out, because if I don't
Yes.
let it out, like, I don't know what opportunities I might miss if I just hold it in.
Right.
Yeah.
You're doing a good
Same thing like
job.
yourself. Like, whatever you're learning, speak about it. Like, talk about it.
Yeah.
Like, write about it. Do a video about it. Do an audio recording about it. Like, now I would suggest for students to chronicle their HIM journey early on,
Okay.
because you know why? When you graduate, you bring that to other students. And guess what?
Yeah.
You're already
That's
seen
true.
immediately after you graduate as an expert in how to deal with HIM programs. That's something I would always suggest.
I'm gonna start recording myself after every class.
Yeah, just like I would do. Let me show you. Like this is the camera minus the microphone. So I have this little camera. You could do it with your phone. I mean, I just, this is just something that I've always had
Where's
for
the camera at? Oh,
this.
there it is.
There it
It's
is.
a
This right
little
here.
one, right?
Yeah,
Oh
this one here.
yeah.
You see it?
Was that
So
expensive?
it's like a $200, but I got it.
Okay.
I got it just for my family vacations, but I never used it. So I'm like, hi, this is it's Thursday.
Yeah.
This is how I'm feeling for the day. And it's just like 2 minutes.
Yeah.
Click. Next day. Hi, I'm taking HS 145. I just did an interview. I thought it was great. Next.
Yeah.
I just took this test. Pretty garbage, but I think I passed. Next. So you take all of these snippets and then you just put it together, and then you just realize that you just made something. That's how this vlog came about. I'm like, could you imagine how many times I could have done that early on within my 12 years of CDI? You know how much I would have, what I would have made with that? I'm like,
That would have
oh,
been so
geez.
much
Yeah.
information.
Yeah. A lot.
Yeah.
A lot.
Well, that's great. I'm so happy that I was able to connect with you and that you even gave me the time.
Yeah.
Like I said, some people didn't even answer. So
Wow.
the fact that you answered, I honestly, like, it was like just how you automatically, like, at first thought like, oh, she's not gonna want to record. And I thought of like, he's probably not gonna answer me. I'm just gonna like go about my day and but I was so shocked. I was really
Mhm.
shocked, and I was happy too at the same
Good.
time, because
Good.
it's very rare that you find people that are willing to share their experience, share their thoughts, share information
Mhm.
that is so vital for people who are just barely starting off, And it's those, and that's what I call those gems, those people, like those hidden gems and people that you don't often
Yeah, it doesn't.
see.
It's not often. Yeah.
So I commend you for that, and
Oh,
I'm
thank
so
you.
grateful that I was able to, have this connection with, because it's it's very insightful, and it was
Yeah.
very helpful. And I
Oh,
hope that we can, continue to talk, and that I can come to you for like any other questions that may arise later in
anytime.
the process.
Uh-huh.
So yeah, thank you.
Anytime. Yeah, it takes a village. It's not just me. Like, repeat this process again, and
Hmm.
you'll, because like I only give you like a small facet of what HIT can do, or
Hmm.
where you can go. I just gave you a very small. Like, you could talk to other people. That's what I did my podcast. That's why I'm able to speak on it, because I've talked to people. Like, I'm going to my
Yeah.
100th episode in about 2 weeks. So it's like I've been talking for like 4 years,
Wow.
doing it. So it's like you might as well start now, because you got like what, 2 years.
Yeah.
By the time you finish, you already have 2 years of networking and communication
Yeah.
underneath your belt, and it didn't require any money at all. It's just your initiative. You're investing in yourself by just going out
Yeah.
there. Yeah.
Yeah. So just keep doing what you're doing to, like, it's very humbling
Oh,
to,
thank you.
like I said, to get someone to actually respond. That was
Oh,
like
I
the
appreciate it.
biggest thing for me,
Well, I'm glad I
and
could
seeing
help.
how far away we are, it's like it's crazy, and it's so, I'm so happy.
Well, thank you. So, yeah, look at that. Almost 3 hours. All right. So that's
Yeah,
amazing. So see what you can do. You thought you couldn't do this.
I know.
Your first shot. I mean, so what happened is that I had somebody who spoke for like 3 hours. And when I proposed that she do a podcast, she was like, "What do you mean? I have nothing to say." I'm like, "You
Yeah.
kidding me? You talked to me for 3 hours." And so now she started a podcast. So it's like you
Wow.
don't know unless somebody is there with you to help you
Yeah.
realize what your full potential is. But what I see
Mhm.
is like you have I see me and you, because when I first started the program, I had the same type of curiosity
Mhm.
like, and not to the point that I'm curious about it, but like curious, like, okay, if I'm curious about this, and you're already planning what you need to
Mhm.
do with your curiosity, you're
Yeah.
already anticipating what you need to do next. That's what I do. There's a certain level of curiosity, but if you don't act on your curiosity to take on to the next step, you're just stopping yourself. Just keep going. Curiosity is nothing to be afraid of. Just be curious, and then when you're curious, ask questions. That's where you network, and so that's how you build your circle of professionals. And then when the opportunity arises, one of these people will just start flooding you
Yeah.
with opportunities, because they see what the potential is. And it didn't require you to get a degree. It didn't require you to get a certification. I'm just doing this based upon what I see and what I'm hearing upon this interview. That's it.
Right.
Yeah.
Yeah.
Medical Coding Geek.com